Coronavirus. How worried should we be about it? A data scientist perspective. I know there are already a number of threads up, but I don't want this to get lost in the noise. What does the data say on the coronavirus? Full thread. Yeah, the human mind has difficulty with exponential growth. Doubles every 6 to 10 days. About 2 or 3 RDS of hospital beds already in use for non-respiratory cases at any given time. Government in the US didn't even bother to ask any questions to people on returning flights from hotspots about exposure to the sick or question them in any way. Community spread confirmed in I'd more than a half dozen now, meaning the cat's out of the bag. Quist larvae. They cancelled SXSW here in Austin. On one hand, the coronavirus is a global disaster or pandemic, and on the other, I enjoy watching the world come together and take these issues seriously. Nitrogen dioxide levels have gone way down over China, so there's a silver lining. Have you seen any recent data on this, i.e. the last week? I recall it being down late last month, but haven't seen an update. So it is going to be 10 times worse than the flu, at 10 million times the cost. Sounds like a logical and industrious way to react to the fact that life is neither safe nor eternal. I wonder when society will be logical enough again to start asking difficult but logical questions that defy feelings, like if it is logical to spend whatever amount of money to extend a life 10 years, or 5. This was sent to me by a doctor. It also passes the smell test. Quite interesting. It essentially says the same thing Chris is saying, but in a different way. Worth a read. Damn. Felt sick to my stomach reading this. Not gonna lie, this made me place a second Instacart order with some more canned goods or pasta or frozen veggies. Just got an email from office that they are implementing loose WFH scheduling starting Friday, and most offices are doing the same, so better have some more food. I bought 15 pounds of brown rice last week, along with some pinto beans, etc. Yeah, this is kinda scary. Here in Seattle, a number of places have shut down. But for some reason, kids are still in school. Crazy. I'm keeping mine at home as of today. I also sent an email to my kids' schools, plus the district that essentially says, dude. WTF are you thinking keeping things open? Nicely, of course, along with a copy of this article. This is what I said in my email. If you're curious, hi, I'm not happy with how the district is handling the coronavirus response. When China was at the spot we are at now, they shut everything down. It was only that draconian measure that allowed them to get a handle on things. We here in the West are asleep at the wheel in comparison. I know that the health department has recommended that public schools stay open. Part of that is because of the impact that shutting them down will have on the community. However, I believe this is the wrong response. We are going to have a very serious problem if we don't start taking things more seriously. Today, a doctor I know sent me this article. It is very well reasoned, and needs to be digested by people in charge of BST. Like I said, I'm not too worried about myself, but since the healthcare system seems to head to complete, I feel it will be a big help if we young people just try our best to not get sick or get anyone sick and spare a bed or examination room. And that is as easy as WFH if you can, and washing my hands and carrying some wipes. Social distancing. An introvert's dream. Yeah, it's remarkable comparing the infection and death rates in China versus Italy. Truly crazy. I think we can all do our parts by staying home if possible and practicing OCD level cleanliness. Really, I totally didn't see the real size of that. A month ago I said that no one in Germany cares about C. I was totally wrong, and I really am a bit afraid of that all. Blimey. That's some article. I'd noticed the news keeps saying there's X number of cases rather than there's X number of confirmed cases. Just goes to show that confirmed is just the tip of the iceberg. Edit. Yep, I just watched the 9 o'clock news and they keep saying X cases instead of X confirmed cases. It must be deliberate. Surely someone knows there's a difference. Socially, the coronavirus is a significant threat to the healthcare system infrastructure. Individually, the coronavirus is a significant threat to people with weakened immune systems and underlying conditions such as cystic fibrosis and COPD that predispose them to secondary complications including respiratory infections and respiratory distress as secondary. Like Bella said, the goal is to slow the spread of the disease so their healthcare system isn't completely tapped to increase the likelihood that hospitalization is available for more people who needs it when they get really sick regardless if it is from the coronavirus. As always, don't touch your face, wash your hands before and after literally everything, and stay away from people showing signs of respiratory infection. Minimize your likelihood of getting infected. Well, my email must have worked. Kidding. The local school district just announced that they're shutting down the schools effective at the end of Thursday. When it's your mom or dad, I'm sure you'll feel differently. I'd be happy about some years more, too. Yeah, the thing is that you don't know how much time you're giving a person. Some people only have their lives extended by a few months. Others, in the same situation, are extended by many years. One guy I know was in the ICU for 3 months. At one point during his coma, he was given 1 hour to live. He recovered and is now expected to live for many years to come. A number of other people were admitted to the ICU during the same time frame for the same condition at his hospital. All of them died. How do you make the call to not spend the money? I mentioned this in my own thread, but never let a crisis go to waste. This is a very good opportunity. There are going to be a few people who do a lot of good and make a lot of money in the next few months. Why shouldn't it be you? You could probably start your own religion now if you felt like it. Lots of possibilities. I'll keep banging this drum in every coronavirus thread that pops up. Problems are opportunities, big problems are big opportunities. Stay calm is bad advice or not helpful. I've decided to play devil's advocate here. The idea that stay calm is bad advice seems fallacious to me. Calmness means taming the emotions. High emotional states lead people to panic, and in some situations, poor decisions. If you are being chased by a wild animal, staying calm may not be a primary concern. In that case, you just need to run, and if a heightened emotional state focuses you on running, all well and good. When you have days or weeks to come up with a strategy for dealing with changes in your environment, a heightened emotional state is counterproductive. People cannot plan in the midst of panic. I am nearly certain that data scientists are not panicking in their data science offices as they work. How on earth would they get anything done? What data scientists need, and what everyone needs if they want to mitigate a bad situation, is a good dose of being calm. Has saved my life and other people's lives several times. Calm and aware. Calm and observant. Calm and reasonable. What good does it do anyone to be less than calm? Why should they expend energy on panic, rumination, stress vomiting, or other not calm things? Thanks, Chris. Is the key always? Also, some think transparency will lead to their incarceration or something, and probably right. The challenge. He says it's all about the response, which is why China is almost down to 1%. Because they lock down entire cities, whereas it would be hard to imagine with USA. Let's clarify though. Data is the key if it is good, valid, correct data that can be used to make good decisions. I'm not sure the qualifier always is the best idea. What if we only had false data? Would false data still be the key? Transparency. Are we talking about clear communication from administrators, with nothing withheld? I might agree with that. That is, assuming the administrators use valid data to form their messages. You are absolutely correct on all. We need you at the front lines. Note, the data from the op is from March 6, over a week ago. It's gotten significantly worse. You can view your specific country, all US cases. I highly suggest self-quarantining. This is the most up-to-date data. But going crazy is so fun to watch. That's a pretty perfect exponential graph. Scary. You are right. How come I did not think about what could happen? Miracles are the norm and unicorns make 90 years old people live to 130 if you spend $10 million on their cancer treatment. I've been so wrong all my life. I think for myself, I'm not going to keep reading information. It's already becoming a reality around me. Now it's just staying focused on something else and remain positive and rely on my infection control knowledge from past experience as a nurse aide. I'd be more concerned about being educated on infection control with yourself and family. Example: private healthcare, and people can make their own decisions. Easy. It feels like the Twilight Zone. Is this real? Earlier the Norwegians called their students home from USA because of USA poor infrastructure on the virus. The place that a certain person preferred over whole countries. That person you cannot even state his resume, his actual resume, because it would be considered bashing. The guy in charge of life or death virus, the one time he told the truth was when he said he could commit murder and not lose his supporters. God help us for a few more months. I know the debate over how much to spend on prolonging life can get touchy real fast, because people have different experiences and assumptions. I'll tell you one of mine. It's not a nudge in either direction, just an example of one individual's preference. My father was healthy and worked as an expert into his late 70s or early 80s. When he was dying at age 85, he could have lived longer with a transplant, and the hospital offered to put him on the list for one. How much longer would he have lived? Who knows? How many people live to be 90? He had insurance and savings that would pay for a transplant, but he declined. His reasoning was the following: he probably had other reasons, but if asked he would mention at least the above. So he chose to simply live out what time he had with his OEM parts. That decision might not be for everyone, but we respected it as his decision. It wasn't easy to come to terms with either. It's hard to let someone go when to give them another year or two. But he did the calculations for himself, and in his case he felt there was only one reasonable choice. Seems like a smart image move from Ma. People rail on the American healthcare system all day long, then ignore which country contributes the most to medical advancements by a huge margin at that. I like your dad. I thought about the same thing for me. If I were to get cancer and the only option was chemo that had, at best, a small chance of extending my life by a year or two, I'm not sure I'd take it. It's a complex problem with no easy answers. Yes, private as in, you pay yourself for your treatment, not as in, the insurance company pays. Otherwise it is still at cost to other people, because insurance doesn't have unlimited resources either. You are right, but it just got me thinking, where are these guys? Too busy giving away dump truckloads of money and resources to be bothered with writing a press release, probably. I love optimism, but data is better. Private as in, the government has nothing to do with healthcare. What's also unsettling is that a crisis like this, mixed with the deep division we've seen everywhere, could also easily spur radicalization. Beyond the healthcare system strain, beyond the people who will get sick, beyond the economic crash. The idea that this epidemic can, and will be used as a recruiting opportunity for people who are looking to start a revolution against insert cause or group. The time seems ripe for that. Depending on how bad this gets, I'd be surprised if that didn't happen. Starting to hear some wonderful things. Entrepreneurs stepping up. while the leader of this pandemic had to be blocked by a judge not to halt funding for emergency food program. This is for you, Chris. You are like an online forensic investigator to me, haha. This one is just sad. A scientist not delivering us data because he's scared to embarrass the leader of this pandemic. OMG. God forbid facts are considered bashing. Is border spreading virus or some others? Let's live in reality. Shall we? Practical steps to take from a doctor. His gig is adrenals and Hashimoto's disease. Does good research reviews.